When someone notices something new or different on their body, it's important to observe it for a period of time and follow its changes. If there's any concern about growth or new things that develop, presenting it to the primary care physician at that time is always wise so that a diagnosis could be established and treatment for whatever the lump or the bump may be initiated sooner rather than later. Soft tissue sarcomas are a type of cancer that originate in the soft tissues of the body, but could also originate in bone. Most tend to occur below the waist, in the thigh or the pelvis. They could occur in any extremity, like your hands, your arms. They could also occur in the head and neck, and they could also occur in a region called the retroperitoneum, which is basically in the abdomen, but sits sort of towards the back. Soft tissue sarcomas can present as a painless mass, often the size of a golf ball, which is approximately 5 centimeters. And more often than not, the patient will not have pain associated with the mass. It's not that pain, alerts them to that part of the body. However, they do notice something either in the mirror or in the shower, and they follow that over time, and they notice that it's getting slightly bigger over time, and that usually prompts a doctor's visit. Some people think it may be a bruise or trauma related. Some people think it may be an infection. Other people may think it's a cyst or a fatty growth called a lipoma. Not often are people thinking that they have cancer at the site of this initially. One class of sarcomas is a retroperitoneal sarcoma, which occurs in the abdomen. In general, these may not present with abdominal pain. However, depending on the size, they can start to obstruct nearby organs like the stomach or the colon and cause symptoms in that regard. Patients with retroperitoneal sarcomas may have different symptoms, such as bloating, abdominal pain, changes in their bowel patterns, or changes in their urinary patterns. Changes in the body are really important to pay attention to. So if something's staying the same size, if something is growing, if something is getting smaller, and also how they noticed it. It's also important to recall those details. Did it appear one day? Did it appear after a traumatic accident? And so putting together all those details will determine whether or not further workup is important. In general, if patients are concerned about something in their body, we always encourage them to present to their primary care doctor, obstetrician, or gynecologist for further evaluation.